Hey mamas, and welcome to the Entering Motherhood podcast. This is your one-stop go-to place for getting you from feeling drained, exhausted, and unfulfilled in motherhood to feeling more energized, organized, and accomplished. That's the vision I continue to navigate towards, and that's the vision we are sharing with you, focusing on holistic alternatives and restructuring your mind, body, and soul from the inside out. I'm your host, Sarah Marie Bilger, a wife, mom of two, mechanical engineer, VBAC mom, and doula, serving mamas through pregnancy, birth, and postpartum. If you're here for this, if you're as pumped up as I am and searching for that fire that you know is deep inside of you, then let's go. Let's uncover what it truly means to enter motherhood. You are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hey mamas, how are you? I am super excited to kick off this episode, and I want to ask you if you know what the most common complication that can arise during a pregnancy or postpartum is. And in this episode, we talk about how that is postpartum mood and anxiety disorders, or also known as PMADS, which is super surprising. And we talk with Susannah Baldwin, and she is a licensed professional here in the Greenville area, but we really dig into this conspiracy of silence and feeling like we have to be alone in what's going on mentally in the postpartum period, and all about self-reporting, the difference between baby blues and postpartum depression, and really that umbrella of PMADS and why it's so critical to pay attention to these occurrences and the feelings that we have in the postpartum period, and it can even show up while we're still pregnant. So I hope you enjoy this episode. We dive into what to look for, what to do, and who to ask when it comes to postpartum mental health. So let's get this episode started. Hello and welcome to Entering Motherhood. Glad to have you here today. How about you go ahead and introduce yourself for our listeners before we get the conversation started?
Sure. Thank you, Sarah. My name is Susannah Baldwin, and I'm a licensed professional counselor in private practice in Greenville, South Carolina. And I work with and advocate for adults and couples navigating their reproductive journey. That's our practice name. We offer individual counseling and training and consulting, and we're home to 5 clinicians. We all have advanced training in perinatal mental health. That's our thing. In addition to the private practice, we do a bunch of workshops and groups, all kinds of goings on. No telling what we're up to is kind of how it feels around here most of the time. I'm also a parent to 4 children, so I really get the joys and struggles. My kids are older these days compared to a lot of the people that may be interested in what we're going to talk about, but nonetheless, been there, done that. Thanks for having me. I'm excited.
Yeah. I am, super passionate about this topic and really just diving into maternal mental health because I think it's something that is starting to become more widely talked about, but I think there's still so much misinterpreted information out there that causes us to just really go on tangents of what is this? What am I feeling? How am I feeling? And there's still that stigma that's constantly surrounding it. So, I love having these conversations, but coming from a professional side that you are able to give, I think is so important too, because there's a lot of, conversations that can be had that are misunderstood, information that's out there that's kind of portrayed in a way that is not a professional manner. So I think, having somebody like you openly talking about it and giving that perspective for moms to really understand what's going on in that perinatal period is really important because we need to have that professional
Yeah.
viewpoint as opposed to, just like chatting with girlfriends and like working out our feelings, which is, good in some ways.
Uh-huh.
But
Yep.
I think there's a different level of like understanding what is going on a more like complex level that we really need to, hopefully like surface level brush on,
Yeah.
but able to allow people to get just like wheels turning of understanding what's happening, in their body during this time and in their mind, and seeing like the differences between what is common and what is
Mm-hmm.
a little bit further of a situation.
Yeah,
So
absolutely. No, you're absolutely right. I think that the value in social contacts and connections and speaking up to friends is completely there. But at the same time, something could be misinformation. We all tend to project our stuff onto the other person's message, which then sometimes gets things a little more tangly than hopefully ideally when you're talking to a professional. That's part of our job, is to not let my stuff tangle with your stuff. And having studied all this information, right, to pass the certification exams and to have the licenses. Yeah. So
yeah.
I agree. I think there's a lot of value in just talking about it in the
Yeah.
first place, but then including expert information.
Yeah.
Yeah.
And I think also too, I mean, a lot of the times in these situations, we do only have like friends or family
Mm-hmm.
or, like our partner. And sometimes, if it's a friend coming to us and they're maybe saying some things and we're not sure to how to like professionally go about it or how to properly help them. I think just understanding some basic information about common things that can be occurring is very helpful in itself.
Yeah. No, absolutely. I agree.
I'm excited to hear, like your professional side of things and what you can share with us today.
Okay. So I'm just going to kind of go into an overview of things, and you feel free to interrupt me or ask me to elaborate if there's something you're like, ooh, that sounds really interesting.
Okay.
And I actually like to start by talking about why it's so important to talk about it, which is what we were just doing. Because there's this conspiracy of silence that is a huge deal around this topic overall, which basically means everybody's a little bit afraid to say, hey, I don't feel right. I don't maybe like motherhood. I don't know what the hell I'm doing. Everybody's a little bit afraid to say that. So because nobody wants to be the first one to say it, nobody else says it either, you know, and you kind of have this classic, hey, how are you? Oh, I'm good. How are you? I'm good. And there's so much more going on that we're not talking about. And then the silence really keeps us from knowing who needs help, what kind of help they need. And it just sort of perpetuates that the system's not set up really well to catch and assess and prevent, because unfortunately a lot of it's self-report. We don't have a like lab test measure really for these. People have to be able to say, I'm feeling this way, or answer the questions this way. So talking about it is actually a really important antidote, again, whether it's to a friend to say, God, I'm not really feeling this isn't what I thought I was going to feel, or talking to an expert or talking to their doctor or experts like that's talking about it and trying to normalize that this is a lot harder and a lot more can happen than is on the surface. So it's a helpful introduction overall. I want to also take a minute to talk about the difference between some important terms. So for starters, baby blues versus more serious things. That's a really common term. Most everybody's heard of baby blues, and it tends to get lumped in. And then it kind of can contribute to this conspiracy of silence because of this misinformation, right? Kind of talked about earlier. So baby blues is a transient period, meaning comes and goes, and it shouldn't last more than 2 weeks. And it's kind of magical, like 13, 14, 15 days. It's pretty close to that 2 week period. And it's going to just be a lot of tearfulness and kind of mood swing and reactivity, but you're still basically yourself. Your basic ability to function and who you are feels present and intact, right? It should not last longer than 14 days, though. That's the trick here. Lots of times women get told that at 3 months, 4 months, it's the baby blues, right? Which is dismissive, that they are likely having something else going on. Now, the tricky thing is some more serious conditions can happen in that same time frame, but baby blues can't happen beyond that. Right. So it's important for women to know that. And the vast majority go through it. It's like 70, 80, 90% in most measures. Right. And seems to be really unrelated to environment or psychiatric history or any of those other risk factors. This is largely a thing that comes from the exhaustion of labor, the fact that you've probably been up all night or already been up several nights in a row. You haven't eaten the same, you haven't slept the same. Your whole schedule just turned upside down. No like typical morning commute and beverage, no typical chit chat with whoever, life just turned upside down, usually within 24 hours. Everything's different. All those things kind of collide to create what we think is the baby blues. Hormones are changing drastically too. On this thought with the terms and what's what, the next one is postpartum depression, just that phrase, which most people know. And there's been a lot of celebrity things and a lot more attention to that phrase, which is fantastic. On the other hand, to me, it also is a little isolating to people who don't identify with having a depressive type symptom. Because that's what we think of. We think of kind of the Eeyore, low mood, tearful, crying, not motivated type presentation. And lots of women, that's not the dominant thing that shows up. And so then they think, well, I don't have postpartum ... because I don't have depression. So I also think it's important to talk about, postpartum depression is useful as maybe an umbrella term for all the things going on. But the official way to talk about it is to say perinatal mood and anxiety disorders. So that encompasses more stuff, PMADS for short. That's not as commonly used a term unless you're an expert, right? You're not going to hear most moms being like, I think I have a PMAD. But nonetheless, I think it's important to recognize there's a lot of stuff besides just depression that can occur during this phase. And most people, even clinicians, we're not really good. We can't diagnose ourselves. We're not very good at doing that. Moms don't need to do that. You just need to have an inkling that there's more than just looking like low, sad that can happen. And if these other things happen, it still might be a reason to go, I don't feel like myself. And I'm in this postpartum period. Maybe I should talk to somebody about it. Maybe I should get a screening. Maybe I should call the hotline and check this out, right? That's kind of my purpose of explaining all of this. So what are some of the things? So we can have postpartum anxiety, which is probably the most common besides postpartum depression. Most of the providers that I speak with feel like anxiety being a dominant symptom is at least equally common, if not even more common than depressive symptoms showing up. We can have postpartum OCD. There can be postpartum PTSD. There can even be first occurrences of bipolar. And the rarest is postpartum psychosis, but that's the one that we see on the news all the time. So, we can elaborate there in a little bit if you want to, because I don't want to go into all of them. I feel like sometimes it gives that impression that you're supposed to memorize this stuff and figure out how to diagnose yourself. And that's not really it at all. My point in naming these is to say, look, a whole bunch of different stuff that's got a lot of complexities can show up in this time. This time, when I've said that a few occurrences now, means anytime during pregnancy, and anytime in the first year after delivery. So I often get asked the question, all right, well, I have a 2-year-old. I'm not postpartum. Well, it's when did it start? And so if somebody's reached out for us for help and they said, I just hadn't felt like myself since 9 months and their baby's 2, then it is postpartum. If there's not been a remission, meaning if the symptoms haven't stopped and then maybe they restarted, then it's still postpartum. And so that's an important measure too. I think a lot of people think, well, if I get postpartum depression at 6 months, I've only got 6 months to go. Because when I'm a year postpartum, I'm not going to have it anymore, right? I'm like, oh, I kind of really wish it worked that way, but it doesn't work that way. That's just when they start. That's how we define this term.
Yeah. I just want to call attention to that even more, because I think that's something that, a lot of people don't understand, if it hasn't been treated, if they haven't worked through it, if it's been an ongoing occurrence, since the birth of their baby, since a few months postpartum, it is something that needs to be evaluated, like you said, a postpartum depression, anxiety. Once you hit that year mark, once you hit any mark, it's not just it magically goes away. And I think it's something that it is kind of common, like, you're like, oh, like I've just felt like this ever since, the baby was born, or since like this happened, or I went back to work, or like things like that. I think like when things then continue to pile up on top of it, like specifically speaking, anxiety, like I know I had anxiety before babies, like
Mm-hmm.
before I even
Mm-hmm.
got pregnant. So then adding on pregnancy and the postpartum, and like you said, that full 24-hour just complete shift into your life, like no matter how much you prepare for it, you don't know what that postpartum period is going to be like for you
Mm-hmm. Right.
specifically until it hits. And I think it's just one of those things that we have to be evaluating and, looking at ourselves and having those conversations to see, what is going on here? Why do I feel so off? Like I specifically remember it was like 6 months postpartum. I was on the floor in our bedroom just crying, saying like, I don't know
Mm-hmm.
who I am. I don't know what I'm doing. I don't know, what I'm supposed to be doing. Like I had been back at work, like had a 6-month old, like
Mm-hmm.
completely just like, what in the world? And here's my husband looking at me like, I don't know what to do. Like,
Mm-hmm.
how do I, he's like, what do you mean?
Yeah.
And it was like something that I had kept silent, like just kind of like pushing through it. Like, this must be motherhood. This must be like what people are doing, because how else are they managing it all?
Right.
I just thought like I was not managing motherhood well. Not that there was anything like that I could work on, and
Right.
like could be, like all my anxiety and everything. So I think it's like important to understand, like if there is those struggles, if there are those feelings, just acknowledging them and kind of like looking at them in a different way and saying like, oh, maybe I can find a professional that will be able to just talk through these things with me and be able to rationalize them and interpret them in a way that's professional and like outside of my abilities, like me like looking at myself. So I think that's just like very big to acknowledge and be aware of. Just kind of think like, when did your symptoms start? Like when
Mm-hmm.
were you starting to feel this way? When did you feel kind of overwhelmed by the weight of motherhood and life occurring? And it doesn't have to be like like you said, that Eeyore kind of mopey like
Right.
drooping around. Like it can look very different for everybody. And I think understanding that uniqueness of it all is important to like call out.
Oh, yeah. And I mean, you spoke perfectly to one of my upcoming points, which is that what's so unique about this time is that symptoms often get hidden by the identity shift, right? And so moms end up thinking that they just suck at motherhood, right? Because these symptoms showed up right when you're having an identity shift. And I don't care if it's baby number 1 or 8, it's still the first time you've been a mom to that baby. And it's still the first time that you've been a parent to those 8 kids. It's still your identity is evolving and changing. And when those symptoms show up in the midst of that, it's really easy to think, I just suck at this. And then the symptoms get missed, right? So even the person experiencing them doesn't know their symptoms. And that identity shift is a really important one, but it's again something you don't really know. I feel like everybody could tell you about it, and until our faces were blue, until you're in it, and then you're like, oh yeah, the way I think about myself is wholly different. One time somebody told me, I love this little snippet story that somehow epitomizes it. Like, before my first baby was born, my partner and I always just like, ate dinner, watching a show, or maybe on the porch, or at 8 o'clock at night, or 4 o'clock, like who cared? It was just whatever. And then magically, when the baby got to be about 6 months ish, was sitting up and was high chair ready, all of a sudden she felt driven, like infuriated if partner didn't make happen that dinner was at 6:30 at the table with placemats. Like that was the part that really kind of captured, like with placemats. And she's like, where did this come from? Where did this, well, it's this identity thing that's cropping up about like, what does it mean to be a mom? And the meaning there was, there's something around meal times and how we do meal times and all that stuff. Like that's just a simple little example, right, of how we start changing in ways that we didn't expect to change. And so that part is so, so important. Every now and then people ask me, why not just call it depression? Why has it got to be postpartum depression? What's the big deal? Well, that's one of the big deals, is that we've got people going through identity shifts. And if we don't address it, then their whole identity gets sort of morphed around this symptomatic, issue and illness, essentially. The other part is we have little bitty people that are 100% dependent on these parents that don't feel well. Right. And so that's the other reason that this is a unique and not just a depression of any other time. It could forevermore change both these people and this family's trajectory if we don't address it. And so that impact is, in my opinion, I'm very biased. This is my thing, right? My purpose. But it can forever impact much more than an individual who's perhaps not responsible for anybody. And of course, that person's important. But now we're talking about double or triple the importance, right? All right, back to some more. I want to throw you some more like, oh my gosh, sort of things. Okay. Postpartum perinatal mood and anxiety disorders are the number one most common complication of being pregnant or having a baby, which I feel like most people, when I do presentations, like, really? Not the whole thing they make me drink the yucky juice for, right? Not the reason they made me write down my blood pressure 800 times. Not the thing they could look at with an ultrasound. None of that. No, none of that. It's the thing that maybe if you have a good provider, you answered a 10-question screening tool about once or twice. That's the thing that happens. And so when you really stop and think about it, you start to realize the disparity between how much we're talking about this, right? Most everybody pregnant knows about, gestational diabetes. They just do. But not everybody knows about postpartum depression. Not everybody's screened for it. Not everybody gets talked to about it, even if they get screened, which is like, we sort of got there. And we don't know what the resources are or how to get help, right? When all the other stuff, your doctor, we expect them to tend to you. They're going to talk to you about it. They're going to test you for it. And then they're going to give you a suggestion of what we need to do about this. And that whole thing doesn't happen with the most common instant of childbirth, which I'm sure, as you can hear from the tone of my voice, blows my mind. I just don't get it. And I won't stop talking about it until I just can't anymore. Or it's just not that way, because it just makes no sense to me. And we're talking about a prevalence of as many as, sometimes it looks as much as 1 in 5 to 1 in 7 birthing people that have a perinatal mood or anxiety disorder.
Yeah. I just saw a statistic that it was like 1 in 3 due to the pandemic.
The pandemic,
yes. It has like absolutely
the 1 in 5.
Mm-hmm.
Yeah. The 1 in 5 to 1 in 7 was pre-pandemic. I was just about to say that. Now it's like 1 in 3. I mean, think about what that means and how many women that are moms.
Yeah. Yeah. And I think, again, it's that like, that silence, that like, well, what does this mean if I do speak up, if I do say something, the shame that's associated with it, or are they going to take my baby away? Or am I like, you start to question if you're capable of caring for your children, that impact that you're talking about, like you are responsible for this other person. Now you do forever like have that responsibility. So, these feelings with the weight of that responsibility, I think overlapping each other is just terrifying sometimes, that like you almost just feel like, okay, well, I'll just like buckle down and manage to get through it. And you try to continue like trudging through this never ending journey of like, how do people do this? And how is this like being structured in a way that like people are making it work? And like that mom makes it look easy, or even, that like anybody, any parent, I think this applies to, because I'm sure, you working with couples and everything too, like if the mom is having symptoms, like that leaks into the partner, and it can also just be something that they're experiencing as well. And I think, again, like that's something that we don't discuss or talk about too, that like the partners of these people like could be having symptoms as well.
Oh yeah. And that is something that even more people give me the funny look for. Like, what do you mean the non-birth partner can have postpartum. Like they didn't have a baby, because we tend to think of it as such a biological process, and it's not just a biological process. Never mind the fact that we're learning more and more that the non-birth partner has some sort of mirroring processes happening anyway, biologically and physically. And they're usually not sleeping either. And their schedule usually just turned upside down. And they're trying to deal with somebody that doesn't feel good, which if anybody's ever had a good friend or anybody going through something, that's a lot of work, to try and kind of keep up that well-being too. So that statistic is like 1 in 10, and that's also a pre-pandemic number. So we're still talking about 10%. And if the birthing partner is struggling, then that goes up. That's a risk factor. So it's more likely that the person is going to be struggling if the birthing parent is struggling, if that makes sense.
Yeah.
So yeah, it's an absolutely important thing to know too. Another collision, while we're kind of at the partner point, is that unrelated to perinatal mood and anxiety disorders, or meaning the statistic I'm about to say is not if somebody has a perinatal mood and anxiety disorder, we've got this issue, but this issue seems to occur regardless, which is that almost 2/3 of couples report a dissatisfaction in their relationship in the first 3 years after their first baby. Right? Like they ain't loving this, basically. Right. And that is worse if there's a mood or anxiety disorder on board. So now we're talking about, we got this high risk of the birthing parent not feeling good. Then we have a high risk of the non-birthing parent not feeling good. And you've got an increased risk now that you are not going to like your relationship. It's not easy to be in a relationship in the first place when you're trying to juggle the logistics of this little person. And now neither one of us are even feeling well in terms of our mental health. So it can just get to be a mess pretty quick if it's not addressed or tended to or talked about in some way. You spoke earlier about the treatment, and I want to elaborate a little bit there to say, I think it's really kind of important to underline there are effective treatments, right? We don't have to just wait for this to wear off, knowing that it might not wear off. It can literally sort of get turned into, this is how you view life and parenting for years and years and years and years and years. And then it shapes who you think of yourself as, right? So there's not a time that I can think of saying to somebody, maybe you should just wait. I don't know why we would do that. I can't think of a reason to do that. One of the gifts of the pandemic was the prevalence of telehealth sessions, for example. So, a common thing used to be, well, there's nobody in my area. Well, guess what? I mean, you can access anybody in the state that you reside in now, which greatly increases your ability to not just a mental health professional like myself, but even medication prescribers, right? Specialists or video supports with other experts and organizations. Like, it's just pretty simple. Even if you don't have internet, you need to go to the library to access professionals than it felt like it was. It was somewhat there before, but now it's just so obviously there. Right.
Yeah.
And so there is effective treatment. It's not like, why bother saying anything? They can't do anything for me anyway. Yeah. There's effective medications, number one, which is a biggie, that are safe, by the way, pregnant and breastfeeding. Okay. There's of course mental health counseling, both of which are proven to improve the symptoms if you're not feeling well. If you do both, it's even better. But if you can't bring yourself to do both, one, it's better than nothing. And there's a good bit of evidence to suggest that doing social support, right? Those are the friends you talked about, or an online support group. And social support shows up in a lot of ways. We have like the truly social, which is maybe the play date at the playground. You're chit-chatting. You might be swapping tips on, life hacks and brand preferences and stuff like that. And that feels very social and fun. But we also need practical social support. Those are the friends that are like, oh, I'll bring you the thing or do the thing. We need emotional social support. That's the people that we can actually talk to about, like, I'm not feeling great. How are you? Where you could dig a little bit more. Sometimes we put the emphasis on just the social support, the water cooler play date, which is great, but we need the others too. We need to open ourselves up to all those. But a combination of these things can really make a difference and can treat. We've proven it helps people feel better and get back to who they want to be and parent the way they want to parent and have a relationship the way they hoped it would be.
Yeah.
you know?
What can you kind of suggest? I think a lot of times maybe we do want to dive deeper and have like an emotional more connection with one of our friends and things and such, but we're kind of maybe afraid or like lacking that like level of trust of, well, what if they tell somebody else? Or can I keep these, secrets safe? Or like, can this
Hmm.
conversation like confined in just this bubble? And I think sometimes like that limits people from being able to open up. So what would you kind of like suggest in like finding those friends that you might be able to like open up and have those conversations with?
Well, I would first, just ask you to consider checking how you normally do that, right? All of us have, I like to use the swimming pools. I'm a metaphor person. I like to use the swimming pool as my friend. How you think about friendship, right? So in a typical swimming pool, there's a few people in the deep end and a ton up in the shallow waiting area. That's mostly how we are with friendships, right? We've got a ton of people in sort of the acquaintance shallow end, and then we have a few people in the deep end. There's never quite as many down there, right? And it's like, how do you know who's safe to go in the deep end with? And not just on this topic, but on any topic. We all have our own way of feeling out safe people. And sometimes we're wrong, right? Sometimes we throw out a tidbit and we get back a stab or a ghosting or a who knows what we got. And we're like, oh, that was not okay. So some of it is about, maybe opening the door slowly for most people. We don't just like, I met you and here's my whole, right? Here's the whole spiel on how I'm doing or not doing. But that we rather say small things like, if we get asked, how are you? We go, you know what? I'm doing okay. But man, some of it's trickier than I thought. And you're right, just little statements to see if they bite. Oh, yeah. Yeah, me too. Like what? And you just kind of keep going in sort of a reciprocal fashion that feels comfortable. That giant oversharing, probably even if it wasn't on this subject, maybe it's about you want to really talk to somebody about marriage, or you really want to talk to somebody about, what's been going on at your work. The dumping and laying it all out there can feel kind of scary. We don't know people, but the gentle sort of sharing back and forth and just paying attention to who we click with. But we got to be willing to say something. That initial vulnerability is where it has to come, or you're never going to get in the deep end with anybody. And so really, I think you just reference that. Of course, if you go to something that's like a postpartum group or that's a designed around deeper conversation, then you're pretty safe to feel like I can just kind of jump in a little bit more. This is what we're here for. Does that make
Yeah.
sense? Yeah.
Yeah. No, I love that like analogy of the swimming pool.
Yeah.
Yeah, it's very true. I think it is something that you have to kind of like test the waters
Yeah.
with
Right.
and like see who is going to be those people. And I think just like the more you interact with others, and maybe it is something like if you're, listening in and like you're pregnant right now, or, like you're even like before you get pregnant, you're kind of like preparing yourself for what motherhood could potentially entail. And I think like starting to find those friends that you can trust now and really develop those relationships with is a good starting
Yeah.
point,
Yeah.
because you don't know what conversations you're going to have
Nope.
once you enter motherhood and really like
Mm-hmm.
dive into it all.
Yeah.
So,
Plus, the other thing is, most instances of postpartum actually start during pregnancy. We're more and more figuring that out, but it's again doesn't have as much, we don't know that. Moms don't know that as much. And so we all sort of think like, oh, it's just gonna like it's once the baby starts, as the clock starts. But oftentimes there's little inklings of I'm not quite myself. I'm really worried about XYZ. I'm really feeling down about changes. You're like, oh, and so I'm throwing that in here to say that's important to remember too. This isn't just oh, the baby's here now, it's time to pay attention.
yeah.
It
Yeah.
can happen when we're pregnant too. And if it does, that's a much better time to get started on
Yeah.
figuring out how to feel better before the little person's here to tend to, and we go through all those changes. Right.
Yeah. So can you
Yeah.
kind of dive in on that a little bit further? And can we kind of, what would be common feelings that are coming up as somebody who's like newly, found out that they're pregnant and having like common feelings of, I think everybody to some extent is like, oh, I'm scared or I'm nervous or how is this going
Yeah.
to work and things like that. So like what you see, what kind of surpasses the level of like what's a common
Mm.
thought process and where maybe those symptoms are borderlining, we should like seek professional
Yeah.
guidance.
Well, this answer is probably going to be applicable to both cases, meaning pregnant or postpartum when I seek help. The gist is that if anything, I don't care if it's anger, irritability, anxiety, meh, sort of just that flat feeling, sleep disturbance, like if there's anything that feels kind of related to mood and anxiety or well-being that is consistently a problem, then we need to ask for help. Right? Period. Consistently a problem. And what does consistently mean? Like, all right, give it 2 weeks. If 2 weeks goes and you have been irritable more days than not, worried more days than not, sad more days than not, you can't, angry. I can't, nobody does anything right. Everybody's irritating me. That's what I'm talking about. And that's it. That's when you just stop and go, I don't need to know all the things. I don't need to know all my risk. I just need to know that there's resources and I haven't felt like myself for 2 weeks. I need to get this checked on. Right. Because we would do that with anything else. If we were talking about some virus, right. And we're like, well, how do I know when to get help? When you're coughing really bad and you have a fever and you hadn't felt good for 2 or 3 days, we're like, that's when you go to the doctor. This is kind of the same thing. If something's going on that you're not yourself for some period of time, it's time to go help, please, or check. I'm not sure, can I get a checkup? Basically, can you see if I'm good? Or maybe this is a transient thing, or maybe I need more help. The exact same way we would do if we were like, is this a cold? Or is this strep throat? Do I have the flu? What do I have? Is this a transient thing? Do I just need to rest or do I need, treatment? Exact same process, if that makes sense.
No,
right?
That makes perfect sense. And I think, like as somebody who's like aware of these kinds of things, like I see that, but like, what do you think is going on culturally that like we do let these mental associations just not be acknowledged as much or as prevalent as like, if we broke our arm and it's dangling there, like we're gonna go get help. But like when there's something off mentally, why are we suppressing it or just kind of, thinking like, oh, it's not that bad, or like, like I can work through this or I can push through this, and we're not acknowledging it as like extremely as something that physically presents itself.
Well, there's so much stigma, right? I mean, we could look back at history. I mean, when you think about extreme things like, asylums and, we just didn't know what to do, but we didn't treat people that didn't feel well and act right very kindly in our history, and not super, super long ago either, So there's this huge stigma, number one, about having any sort of, I'll just say dysfunction sort of generically in this department, right, of mental well-being. But then also we all have this notion that it's just controllable. It's mind over matter sort of thing. That if we have a mental symptom, it's because we're sort of weak in our constitution or weak in our character. And we don't believe that if we broke an arm. We have this ability to say our body is not under our absolute control, right? Like we have a lot of influence and whatever, but it's not under our absolute control. It could just have an illness or a disease or an injury, and I can't fix that with my thinking good about it, right? But we have this idea that mental illness, if I'm anxious, you should just stop worrying. Or if I'm sad, you should just smile more and see the silver lining and get up and go. We just don't give it the same weight to understand and to say, what, we can't control every aspect. Some of this is a biological process. We can influence some of it that way, just like we could probably influence some with our broken arm with ice and not moving it around and using basic first, like we can influence some improvement, but we can't just think our way out of it. No different than we can think our way out of high blood pressure or a broken arm, but it's like people think we do, we hear that stuff all the time. Just get up, just smile more. It's not that bad, just stop worrying. Oh, sure. It was that easy. I mean, I'll get right on that. It's like, I love when that happens. Thank
Uh-huh.
you
Or
so
yeah, and
much.
I think a lot of times I hear too, like, oh, well, like just meditate or,
Mm,
practice, like go on a walk or run and like things like that. And it's like, okay, like that might work for somebody who mentally
yes.
is stable, but like if it is that persistent, like more than 2 weeks, or you can't get it
Yeah.
out of your mind, it's that like obsessiveness of it. A walk isn't gonna do it. Like,
No, and a walk might be, you know what? A walk's probably never bad unless, it's a broken leg. It's never broken arm. A
right.
walk's never bad. I mean, we might even make the suggestions about here's part of how we're going to help you get well. Dot, dot. Let's get some movement happening. Okay.
Mhm.
But yeah, it's not enough. And to say that that's it, right? Or to hear that's all I need to be doing and I'm doing it, it's not working. It just makes the message now like, now what's wrong with me? I
Yeah.
can't even meditate and walk my way out of this like so and so did, you
Mm.
know. And again, kind of having that understanding, it does work for some people. Have a very mild thing, and there it happens. People have a super mild symptom and they make a few changes in their life and they feel better. I still say, well, see, they made some changes. That was their treatment. Fine. Okay. But everybody needs different treatment, no different than the illnesses, right? Some
Mhm.
of us catch the flu and big deal. We rest and take some over the counter meds and OJ and we're good. Others need lots of time and lots of assistance in recovering. And we don't judge that necessarily so much,
Yeah.
right? Or think, oh, what's wrong with me that I still have this cough? We just treat it and hope and do the things we're supposed to do. Right.
Yeah.
So thanks for those questions and the digging in with it. So let me talk just a little bit about some resources. The biggest one for nationwide, realizing that, you're not all in the little town that I'm sitting in at the moment, is the Postpartum Support International. Their website is postpartum.net. It's easy to remember. They offer so many things. I mean, I have to say that they were great before the pandemic and now they're amazing. There is online groups led by experts every day for varieties of topics, not just postpartum, but being pregnant and having an issue, women of color, if you're in the military, maybe you're pregnant after you've had a loss and there's anxiety around that. Maybe you've had a loss. Maybe you're in an LGBTQ situation, relationship. I mean, everything. It's unbelievable. Every time somebody asks about a special population, I'm like, let me look. I'm sure there's one there because they got it all going on. They also have tons of resources for birth partners. They got resources for professionals. If there's one resource you hear from today, that's the one you need to know about. You need to know about Postpartum Support International. And most states, by the way, have chapters. So you should also look into your state and see if there's a local chapter that might be doing fundraising, awareness you can get involved with, may have some more local goings on that you want to check out. There's actually, it's less than a year old. We now have a national maternal mental health hotline, which I feel like is such a huge deal. So it's no more like, I mean, of course, there's the great crisis lines and all that. And people may know that 988 is the new kind of emergency number for mental health. So we also have that in the last year. Instead of 911, you can call 988. Okay. That's a nationwide thing, but that's generic for any sort of crisis. The maternal mental health hotline, which is 844 943 5746, is specific to maternal mental health, which lots of, it resonates with a lot of people to know that, that thing you spoke to earlier, like, how do I know they're not going to judge me or think that something, I can't take care of my family? Because they know, right? They're trained and they know the differences between these things. And rarely is it a problem with you not being able to tend to your family or needing to be reported to somebody. That's super rare, and they know the differences. So you can feel safe in reaching out to those things.
Yeah, I think it's important to really call out those resources and say that there are resources available no matter where you're at. And, like you are local to Greenville. Like, obviously, if
Yeah,
people are listening and they want to get in contact with you and your practice and everything, like that's something that they can certainly, reach
absolutely.
out and do. So, like, how about you give,
Yeah.
information on how you can contact you as well?
So we are located in person in office in Greenville, South Carolina. People visit us all over the upstate. So, anybody that's nearby can come in person. But we also serve families all over the state of South Carolina. So again, virtually, you can live anywhere in South Carolina and we can help. And we're actually working on getting some licensors in some other states. So soon you won't have to live in South Carolina, but right now you do. We do offer coaching. So if people are having less symptoms and don't necessarily need mental health counseling and live in another state, we offer coaching, which looks more goal oriented. That's more of a, man, I really need to change this thing. I've got this situation or these parenting tips and stuff I need to adjust, and I need some help and accountability getting there. Normally that's a part of what we do in counseling. We just don't do the counseling part if you live out of state. So anybody that's out of state can consider that. And I also do professional consultations. So providers in other states across the country that might need help with a clinical case or a topic or want to discuss that, I'm available to do those as well. I've been doing exclusively perinatal mental health work for 12 years now and have a certification in perinatal mental health. And so I'm very comfortable in that expert role and really like helping other people make sure that they're kind of keeping up on it and doing their best.
I love that. Well, is there anything
Thanks.
else that you would like to add to somebody who is in that newly postpartum period or pregnant currently, and just maybe words of wisdom or a little something that you wish that you would have heard when you were first entering motherhood?
Yeah, I think that the simplest way to say it is that, expect the unexpected, which feels super cliche, but come what may, it's not your fault, right? Like, this is not something that you did or didn't do, and that there's ways to get feeling better. You're not alone. There's massive amounts of women and people going through changes, and it's okay. And to just say, can somebody help or somebody feel this way? I think means a lot. That if you've heard this and somebody that's listened to this whole podcast is already doing great. They're already, I say that at the end of every talk I do anywhere. Yay, you just completed a huge, like, now you're in the game, because now more about what to look for, what to do, and who to ask than you did a little while ago. And that's a great start. So yeah.
Awesome. Well, thank you so much for sharing everything that you
Yeah.
know and really opening up the conversation around perinatal, maternal mental health. So
Thanks, Sarah.
thank you.
It's been great. I love talking about it.
Thank you, mamas, so much for listening. Remember, you are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hit that subscribe button, share this episode with a friend, message me, email me, call me, beat me. You know how to reach me. We're doing this, mamas. I am so excited to catch you here next week. This is your one-stop go-to place for helping you find the resources you need to make the best choices for you and your family during pregnancy, birth, and most importantly, postpartum. See you later, mamas.